So let me start just by talking about something that is fantastic, which is that across the UK and in Bradford, people are living for longer than they ever used to. That's a real success story for the UK, but it brings three very specific challenges. The first is that people are living longer, yes, but they're often living with long-term life-limiting conditions. And that means that we need to find different ways to support them. The second thing I would say is that although most of us are living longer, there are chronic, huge inequalities in life expectancy within the United Kingdom, and particularly in the city of Bradford. You can expect to live 7 to 9 years less if you're born in one part of the city than if you're born in another part of the city. That's not a good thing in this day and age. And the third thing is, we are a victim of our own success. There's a huge pressure and demand on health and care services, and there's insufficient budget to meet that demand if we continue to provide services in the way that we always have done. So those are some of the challenges we've got to meet: providing the right services to people who are living longer but not particularly well, closing those health inequalities, and ensuring the budget is sufficient to meet demand. The DHEZ is an exciting opportunity for Bradford, isn't it? Because it builds on acknowledged strengths that we've got in research and development in the health sphere in academia. It builds on the digital cluster we've got in the business sector, and it builds on the health and care system's appetite for innovation and digital technology applications in delivery of health. And it'll help us in addressing some of the challenges I talked about, because some of what's being developed right now that we can deploy will really help us do those things. Things like apps for health, self-care in health. Recently there's been a fantastic innovation in pain management with an iPad app which allows you to chart your pain over a period of a day. You can go to the GP and you've got much more of your own information with which to have a dialogue. Things like integrated care records for people being treated through the health and care system means that you only have to have one conversation with one health and care professional, and they will know much more about you and your treatment pattern and be able to give you the help you need at the right time. Those are just two ways, but I think that there are many more applications and technologies we can deploy through the fantastic work that will go on here that will start to crack some of those issues. There's two big opportunities here, I think, for the DHEZ. The first is absolutely the development of products and services that tackle those, what I would call, wicked issues. So some of the things that will be developed here will help with some of our agenda around self-care, so that people are in charge of their own health. They know what's happening for them. They can have a more active dialogue with their clinician. Second thing is about integration of services in health and care, and I think some of what's produced here will help hugely in the integration of health and care. But let me just also talk about the other reason why I'm excited about the DHEZ, which is about fostering and nurturing the entrepreneurs of the district, and particularly the digital entrepreneurs of the district. And we have the youngest city in the UK. It's a digitally savvy entrepreneurial community. This is a huge opportunity for them as well. And actually, people who are entrepreneurial in work, earning money, do you know what? They have better health too.